Hello, you're welcome to the Teacher Channel. The Teacher Channel, this is where we talk about life. I'm so happy that you are here, and I want to thank you. I want to thank you for watching. So today's topic is very interesting one, and the topic is emergency scene management. Emergency scene management. And when we talk about emergency scene management, we're talking about how to manage an emergency that occurred in a particular location or place. So how to manage emergency that took place in a particular location. Okay, so when we talk about emergency scene management, we're also talking about step-by-step way to provide first aid during emergency. Step-by-step way of providing first aid during emergency. So that is what emergency scene management is all about. So it comprises a series of actions taken to address emergency. Series of actions taken to address emergency. Of course, emergency is an unplanned situation, an unplanned incident that happened in a particular location to one person or more. Okay, so emergency can happen to one person, emergency can happen to a group of persons, emergency can happen to an infant, emergency can happen to a child, emergency can happen to adult. Those are the three categories of patient. Patient is the person that you are trying to help because the person is in emergency. So remember that the person who is providing first aid, the person who is providing first aid is called first aider. And the person that first aid is provided to is called patient. Okay? So when I mention patient, I'm talking about somebody who is in need and who is receiving help from the first aider. So during the emergency, there are a series of actions that the first aider take to addressing that situation that put the person in need. Okay, so those are the three definitions that will guide our discourse. So this definition, three of them, again, I want to go through these definitions. Emergency scene management, what is it about? How to manage an emergency that occurred in a particular location or place. Step-by-step way to provide first aid during emergency. Step-by-step. Okay, way to provide first aid during emergency. That is what emergency scene management is all about. It is also series of actions taken to address emergency. There are many types of emergencies. Okay, high fever in children, somebody falling from height and breaking bone. So you have asthma, you have allergic reaction, stroke, heart attack, cardiac arrest. You have somebody going unconscious or somebody fainting, low sugar, high sugar. There are many seizures. So there are many emergencies. So whenever any of these emergencies happen, it could be wound, it could be accident, car crash, or somebody fallen. somebody falling from some height and wounding himself, or maybe somebody cutting maybe some vegetable and then you end up cutting yourself and giving yourself some wound. These are all emergencies. So when that happens, there are step-by-step way of trying to help this person. And that is what this presentation is about. So in other words, what I'm going to tell you now is first aid in a nutshell, at a glance. So I want to summarize first aid, within the few minutes that I have to do this presentation. So when you talk about first aid, you're actually talking about coming to somebody's aid, helping somebody. And when you do that, you are managing emergency. So we call it emergency scene management. And that emergency happened in a particular location. So there are four broad actions that one takes to manage emergency. Four broad. Okay, so I'm going to put them on the board. Okay, four broad divisions, four broad steps that you go through. So what I'm going to say now will serve as a guideline, is a template, is a recipe. So whenever emergency happens, these four broad steps I'm going to put on the board will help you manage that emergency. And that is actually how you are expected to follow. Remember what I said before, that emergency scene management is a step-by-step way to provide first aid. So there are four broad steps. Okay, so I will list the four broad steps and then I will go ahead to fill in the activities that make up each step, each broad step. Okay, so step number one is what you call scene survey. Scene survey. Okay, scene survey. Step number two is what you call primary survey. Okay, primary survey. Primary survey. Then step number three is what you call secondary survey. Okay, secondary survey. And then step number four is ongoing patient care. Okay, these are broad steps. These are broad steps. When you do first aid, this is the guideline. This is the template to use. This is how you manage any type of emergency. It doesn't matter where it happened, whether it is at home, whether it is at work, whether it is in the field, on the road. It doesn't really matter. So this is a generic formula, so to say, a template, okay, that is not dependent on the location where emergency happened. And it doesn't actually depend on the person that suffered from the emergency. So it's a general recipe, general template that you can use any day, anytime you are managing emergency. So let us go through the steps again. Step number one is scene survey. Scene survey. Okay, scene survey. That is the very first step. So whenever you are managing emergency, the very first step is scene survey. And then the second step is primary survey. Primary survey, that is the second step. And that is after the first step. Then the third step is secondary survey. secondary survey. Step number 3, secondary survey. And then the last one is ongoing patient care. Okay, so let me define each of them before I provide details. Okay, since survey is a quick assessment, okay, of the environment where emergency happen, and what are you assessing for? You are assessing for anything that is going to constitute a hazard to you or to other people that may join you. So you just scan around, okay? You need to look around, make sure that there is no danger, make sure that there is nothing that is going to harm you or harm the patient or even harm the people that will be joining. During an emergency, yes, other people may join you later. EMS may be called. Bystanders may be called. Okay, so you want to do this initial assessment to make sure that your safety is guaranteed. So the main concern of since survey is your personal safety. Okay, so that is it. So it's assessment of the immediate environment where the emergency has happened for safety, for your protection. Okay, so step number 2, which is primary survey, this is where you focus on the patient. So primary survey is where you focus on the patient. Remember, since survey here, you are focusing on yourself, okay, because your safety is number 1 here, your safety. Here, then, this is where you now focus on the patient. So what is primary survey? Primary survey is a rapid assessment of the patient to determine if that patient is in a life-threatening condition. So again, this is assessment, but this time you're assessing the patient. Okay? What are you assessing for? You want to know whether this emergency is a life-threatening emergency. You want to know whether this patient is in a life-threatening condition. So that is primary survey. Now, secondary survey is done after primary survey. Usually you do secondary survey when there is delay. Okay? And the focus of secondary survey is on other emergencies, other injuries that are not life-threatening. Remember, life-threatening injuries are dealt with here. So here is, the main concern of secondary survey is other injuries that may not be life-threatening in nature. You usually do this if there is delay. Maybe EMS did not arrive on time, so you have to go to secondary survey. Then ongoing patient care. Ongoing patient care means that the help you provide to the patient is an ongoing thing. Okay, is an ongoing. So that's why you call it ongoing patient care. What that means is that as long as that patient is with you, as long as you have not handed over to EMS, you have not handed this patient, EMS has not taken over. Okay, you are still with this patient. You are expected to keep on helping this patient in an ongoing basis until you hand over to EMS. That's what ongoing patient care. Okay, so this is the first aid. When you hear about first aid, this is actually what first aid is all about. Even though there are activities that are done under each category, which I'm going to list soon, but you need to understand what each category is about. Okay, since survey safety, you are assessing the environment. You're assessing whether it is at home, whether it is in the field, whether it is at work. You need to assess the environment where that emergency happened, because you don't want to be another victim. You want to make sure that your life, nothing is going to constitute hazard to you. Nothing is going to put you in harm's way. That is what a scene survey, and it is very important. You have to assess. Okay? So primary survey, you are now focused on the patient. You want to know whether this patient is in life-threatening condition. Whether that patient is in life-threatening condition. That is what primary survey is about. While secondary survey is about assessing for other injuries that are not life-threatening in nature. And ongoing patient care means that you keep on helping. You may have given this help. Then if there is need to give another help, okay, as long as you are there, you are required to keep on helping this patient, okay, in an ongoing basis. The only time you are free, okay, is when you have handed this person over to EMS, or when this patient has, formally told you that he or she is okay. So you have disengaged, normally, because this patient is now okay. Okay. So that is what emergency scene management entails. So let me start filling the gap a little bit, filling each of these divisions, categories. So the main concern here is personal safety. So this is why you do this, personal safety. I did a video on safety. So go to the teacher channel, look at that video on safety and protection matter. Safety is important, and that is actually what this highlights. So scene survey focuses on personal safety, your personal safety, and also your protection. Okay, so safety and protection are not the same. Okay, remember that safety is all about the environment, environmental factor that can hurt you, that can constitute barrier to you. Why protection is every measure you take against contracting disease or even transmitting disease. So that protection, like putting gloves because somebody is bleeding, or maybe you want to provide wound care, okay? Using pocket mask to breathe into the patient when you do CPR. So those are barriers between you and the person so that the disease will not transmit either way, okay? And also this is where you obtain permission, okay? So this is where you seek permission or consent, okay? So, and of course there are some other questions you may be asking at this stage. Question like, how many patients are involved? What are their status? Do you need help? So those are some of the questions that may come to mind, okay? So that's it. So, of course, for you to move to the next step, I assume that you have cleared all this, so all this should be okay. Okay, your personal safety must be granted, your protection must be taken care of. Okay, of course that is your responsibility, and then you have to obtain permission. Okay, just tell the person, can I help you? Okay, so when you tell the person, can I help you, you are seeking permission right there. Okay, if the person is conscious, the person will give you what you call voluntary consent. Otherwise, if the person is unconscious, you use what you call implied consent. So primary survey, this is actually the key. This is the key step. So this is where you now assess the patient for life-threatening condition. So remember, primary survey is life-threatening. You are assessing for life-threatening condition. So for you to assess for life-threatening condition, there are four aspects, so four areas you need to assess the patient for. There are 4 areas, 4 variables, and I call it R, A, B, C. So you need to assess the R, A, B, C of that patient before you can conclude that this patient is in a life-threatening condition or not. You have to assess four areas. R means responsiveness. So responsiveness, okay, responsiveness. Okay, that's what R is. Responsiveness is the same as consciousness. Is this person conscious? If you say, hey, are you okay? Can you hear me? And then you tap the person's shoulder. Can you hear me? Can you hear me? So what is the person's reaction? That is what we mean by responsiveness. The person reacts in any way that suggests that the person actually is in contact with the external world, that the person is actually picking stimulus or stimuli from the external world. That is what responsiveness is. So you need to assess the person for responsiveness. You need to also assess the person for airway. Airway. The person's airway must be assessed. Is the person's airway open? Airway starts from the nostril to the lungs. So it's a passageway. That is what we call by airway. So you need to assess. Okay? So for somebody who is conscious, let's assume you say, hey, are you okay? Can you hear me? And the person looks toward you. That means the person is conscious. The person is responsive. So to assess for airway, let the person talk to you. If somebody can talk to you, that person's airway is open. So another thing you assess is breathing, normal breathing. So is the person breathing, and is the breathing normally? Okay? And then C is circulation. Look at the skin color. Look at the skin temperature. If you touch the forehead, okay? For instance, somebody is unconscious. So you do what you call head teaching lift. Okay? You open the airway and then you check breathing. 5 to 10 seconds, see whether the chest is rising and falling. And then check the skin color at the same time. Of course, your hand is touching the person. When you do the head teaching lift, your hand is touching the forehead. So you can feel the temperature from there. Okay? And so the skin color, look for bleeding. Okay? Bleeding. Is there blood? All right? So responsiveness, airway, breathing, and circulation. Okay? So for somebody to be in a non-life-threatening condition, all this must be okay. So if any of them is not okay, that person's life is threatened. Okay? If the person's any of this, if the person is unresponsive, for instance, even if others are okay, as long as there is one that is not in good shape, that person's life is in danger. Okay? And then, of course, this is where you are most likely going to carry out a lot of first aid activity. This is where you use a lot of skills. So I'm going to continue this presentation in part 2 of this topic. So watch out for part 2, which is coming. So over here, secondary survey, this is where you check for non-life injuries, so you look at history, you look at vital signs, you also look at head-to-toe assessment. So I will talk more about these broad categories in the second part of this video. please watch out. And I want to thank you for watching, and I want you to subscribe and share. Thank you. Bye.